So I hope you enjoyed your lunch. Right? I'm going to ask everyone to make sure your phone's on silent so it doesn't interrupt anyone that's coming up here on the panelists. And we're going to jump right into learning more about the future of healthcare. This is why we're here. So let's hear from some more people. So we know on-demand healthcare is really crucial. Since COVID, everybody wants to say, hey, I want a doctor now. I need my answers now, and everything is more accessible and attainable. And so the next panelists we're going to have on stage are going to talk about 24/7 access to healthcare, right? There's a lot that goes into this. There are pitfalls we're going to identify, there are challenges that have been overcome, and a number of different things that we're going to discuss, and hopefully have enough time for questions. So as I mentioned, hashtag Health 2.2Conf, Health 2Conf is the hashtag. Use it so that the organizers can repost and other people can see your content across all social media. We're streaming live on YouTube. We got the channel going live so people around the world can see you and highlight your expertise and listen to what you have to say. So without any further ado, I'd like to first invite our moderator up for first panel, second half of the day to the stage. Let's welcome, round of applause for Fatima Shokoya. Come on up to the stage. On-demand healthcare and plans is what we're talking about. You good? Nice to see you up here.
Thank you, everyone. I'm really excited to be here and share the stage with all the amazing professionals today. Amongst two amazing women with me on the panel today, discussing on-demand healthcare solutions. As we see in the post-COVID era and just generally with digitization, the world has opened up. Patients are more in control of what they want and how they would like to approach their health and their healthcare solutions. So it's definitely a field that has rapidly evolved. And there's a lot to discuss about it. So first of all, I would like to invite Sylvia Mikalo on the stage, who, yes, please, round of applause for her. Who is a HealthTech sustainability specialist. So very happy to share the stage with you, and also with Dr. Amal Al-Hafadi. Please join us on stage. Who is an associate professor, especially specializing in women's health. So thank you very much, ladies, for joining me. Please take a seat. I think I'm going to come on to this side. Thank you. This is a bit more intimate setting with you. Oh. So thank you very much. I think it's a very important topic to discuss, and I think one of the main takeaways from Dr. Mariam's earlier presentation for me was to really define certain topics, certain expressions that we use on a day-to-day basis. So my first question would be, how would you define on-demand healthcare plans and available solutions today? What are the ways you see this works at the moment? How would you define it?
You want me to start? I will go first, then the expert will give you her opinion. Thank you so much for you and for the conference. As a physician, this is a very difficult question for me. Demand is not a healthcare term, it's an economic term. So demand is dependent actually on what the people want and what can they offer, or they are happy to spend on it, which is not the case usually in health. Usually we hear it more in other markets, but we are now seeing it in health very clearly. So to answer what the patient or the customer they are looking for and they are willing to pay in healthcare is not an easy. But one of them actually, as she said, they are looking for 24-hour service. This is one of them. But actually to define it, we have to look more. So we need to know our population and their needs, and we need also to know what are they willing to pay for and what are they looking for. This is from their aspect, but we have another aspect from the caregiver or the policy maker or actually the government. There are a lot of aspects, but it's a matching between the customers who are the patient in our case and the caregiver or the policy makers. And they will keep it for you. I think you are more familiar with the term than me.
Well, as all of us, I suppose, nothing special, I would say. We are all learning by doing in this field, in health tech, every day. And I would say that when we consider this, well, I totally agree with Amal, that it has to do with purchasing. In the end of the day, it's the pocket that is important. And every day, more and more, patients are paying from their own pockets. And this is important. It's an important issue because medicine is advancing at the speed of light. And medicine, every time more and more, is more personalized. It's ad hoc. And more than this, we are covering pathologies at the rates that would have been inconceivable before. We are having these digital twins where we are testing our drugs and we are treating at the right moment with the right drug at the right amount. And this is something that it's the progress of medicine towards translational medicine, a more personalized medicine, and a more ad hoc medicine. And if you permit me, we could say predictable medicine towards this progress. And according to this, and what concerns to us, which in the health tech field, I would say that, in my opinion, we are the enablers of all this. I said it before and I repeat it. We are the ones that are providing these health tech solutions that are answering the unmet needs of the patient in the right moment of the patient journey. And this is helping us to narrow the gap in between the early diagnosis and the better prognosis. So what does this mean in the end of the day? Healthcare outcomes and what Amal was saying in the first place, the purchasing of health. Everything what we do, it's not only impacting health, it's impacting sustainability. And it has to do with expanding the lives of the patients at high quality rates of quality of life. What is called QALYs, quality adjusted life years. And more than this, not only this, we are impacting the pocket of our patients, but also from the stakeholders in the public healthcare systems, because we are impacting health economics and outcomes research, and this should be the headlines that we should have in our minds since the very beginning. The HEORS, QALYs, and personalized medicine. It's not only about solutions; it's about high-tech solutions, and this is what. Maybe it's an utopia, but it's being possible, and it's being possible day and day. And we are on this path, and we should aim for it. We shouldn't aim for a Me Too, something else that is already in the market. No, we should aim for something else, something that covers this personalized medicine of the future that we are all aiming for. And this will enable every single home, every single patient in the world, because all of us are patients, all of us are citizens of the world, and we deserve higher standards of healthcare. And this goes through sustainability. And thank you so much.
I can completely connect to what you just said, Siva. They would definitely have to aspire to something higher, and we can reach it faster and faster as we have evolving technologies. So it's definitely something to strive for. And something really struck me, Amal, when you mentioned patients as customers, and I think this kind of dynamic has vastly changed, and there's actually we're closer to a consumer perspective than to how can I put it, and the patient being a passive participant in their journeys. So this, I think, is really important, and there's so many layers within healthcare. What I see, we are in this field, but at the same time, the patients are within their own lives, have a specific narrative of their healthcare and how they go through life with their health and their health management. So that's something that might help us to put ourselves a little bit into that perspective and try to bring the solutions that will really affect them positively. And that brings me to my next question, which is, how do you see, does on-demand healthcare suit into the current system? Is it going to replace it? Is it competing, or can it exist side to side? What are your insights?
Before answering this question, actually, there are another part which we didn't actually say it, but to start with, we cannot start with it. Part of all of this is access to the healthcare. So access to the healthcare is different from really city to city, from country to country, from insurance to insurance. So to be able to reach that degree, we have to ensure that we have equal access, equality for everybody. And the access is not an easy issue to discuss it, but to be able to answer the question, we need to know it. So from different aspects, we will take it. The patient who can offer their treatment, I think it's easy for them, and it's very easy, and we make it really much easier for them to contact and to choose and to protect what they want. But for those who are really totally dependent on the government healthcare, or they are dependent on the insurance, so again here we have to really speak with everybody alone. So health insurance, I think they need to change a little bit, and they may need to be more flexible. And I can see that in some of the insurance, but I cannot generalize it. But yeah, we have some insurance. They give their patient the highest quality. They give them the availability to choose whatever they want. But again, health insurance, I think, depends also on which type of insurance would you choose. So those who will pay more, they will have more. And those who will pay less, they will have less. So again, by the end, we go back to the customer preference and how would they deal with that. In terms of insurance, the patient will be able to choose what they are able to go for it. But if we are speaking about equal access, it will not be the equal. But maybe in the future, we can do something more. I'm aware that there are some countries, maybe not all, but some of them, they have a really very good government insurance in which they will allow the patient to go to the doctor. They will have the same access. Some of them, they will allow them to choose even the doctor, but some of them no. But by the end, they will have the same facility and quality of treatment. But in other countries, no, they are still, or maybe they are working on it, but I'm seeing a change in the future. Since the patient, they are no part of this, so they will choose whatever they are going on it. So I'm seeing in the future, the market for the insurance will change. There will be a lot of competitive, and the patient will be able to choose. Going back to those who cannot offer the insurance, until now, if there is no health government coverage, I think still they don't have the access. Maybe the governments will try to solve it by charity, for example. A lot of actually doctors or healthcare, they have initiation or some initiative to help those patients. I can see that in India. I was speaking with my colleagues. There are a lot of examples in India, actually, for example, eye hospitals and some of the orthopedic hospital, and they did very well. Maybe they can take that as a model in some other countries. And I don't know about a different country, but at least I know United States, Europe, and even in Saudi Arabia, we have our initiative or charity in which the doctors will go to different areas in the same country or even abroad, volunteering to help the patient. And this is maybe also another aspect. But by the end, there will be still some variety, but I'm seeing it's much better than before.
Yes, that definitely I couldn't agree more with you, Amal, and thank you so much, Fatima, for the question. Such an interesting question that assesses a lot of subjects, main topics. As Amal was introducing this equity access in terms of healthcare for all patients, it's not easy. It's not easy, but it's affordable and it's possible. And we are in the early stages of this. We are starting step by step, and we are crossing barriers little by little. One of the barriers is the data sets that we have. When we are speaking about personalized medicine and high standards of healthcare, we also are speaking about high levels of data sets. We need to uplift this quality of the data sets that we do have in healthcare retrospectively than the ones that we have now, and prospectively, thinking about the future. All of them tokenized, anonymized, and preserving the security and the ethics of each single individual, of course. But this is what's gonna push us towards the next level. And when I say datasets are the house of all what we are doing. And they are very important. And not only elevate the standards of datasets, but also the accessibility of datasets. Because if we treat datasets how we should, they would be accessible, and this is the key to success. And enabling this permeabilization of datasets, we could say. And healthcare cross-border is possible. We are at the first stages, but we should aim for one single healthcare. And this comes from thinking about solutions that can go cross-border. And when we think about this equity and fully access for all patients, we should think about not only ourselves, but also globally. And governments are already permitting this. I see steps every day, but big steps. And this is amazing, because 5 years ago, nobody spoke about this. And still, there are some solutions that are years forward from where we are sometimes. So we should try to equilibrate all this, and also in terms of equity and fully access of highly standards of healthcare, as we were saying. To answer.
Thank you so much for your insights. I think it's you touched on really important points and ways to open the possibility up for more and more people to be able to look after their health, which is of primary importance. I would like to go a little bit deeper into the factors that you see pro or con on-demand healthcare. What would you say are possible pitfalls that you can see in the system right now that's keeping it back or doesn't allow it to grow to its full potential? And what are the big pluses? You already mentioned some. There might be some more that comes to mind that would enable all of us as professionals to either try to get into it or encourage it, or just to shape our views on on-demand healthcare.
Well, what come in my mind now actually is the virtual healthcare, online access. I think it was a big jump last few years. And although maybe as a physician, we were a little bit hesitant in the beginning, and you may find some resistance from some of us because it's really difficult to evaluate the patient online or by phone. But in the same time, actually, it offered give access for a lot of patients. Some of them, they cannot offer the same costs in reality, so in person. And in the same time, some of them, they cannot access the facility because they are far away, or they cannot come, or for different reasons. So when you want to take the cons and cons, I think it helps a lot of patients, and it gives them access for a lot of facility which I think they cannot offer it from before. And it shortened the time that they can be seen, or they can ask. So some of them, they will call us, or they will speak with us, then we'll tell them, no, it's urgent to come now. So it makes a lot of difference, really. During the pandemic, actually, that was the only way to contact our patient and to bring them near to us. We cannot keep the flow in the hospital in the same way. So there are some disadvantages, but I think the advantages is more for us and for them. And I can see that we will have much better in the future. So for example, as a surgeon, I'm thinking that yes, it's possible now to say that we can do virtual OR in the future. So instead of asking the patient to travel far away or to spend a lot of money to be treated, it can be doable in the same area in just near future. I'm thinking just only to solve the gap of the internet, and it will be there. So yeah, I'm with. This is, for example, nothing is complete, but we have to balance the stuff. And if the advantages is more, I will be with it.
Okay, I totally agree again. I couldn't agree more. And I would add that from my point of view, artificial intelligence is the key. Okay, I really think that we should delete the fears that we have towards artificial intelligence and embrace it. Because artificial intelligence is the jump, it's the bridge towards this optimization of the patient journeys and this equity in terms of accessibility. And when I say artificial intelligence, I'm speaking about all the stakeholders of the value chain, not only the patient, but also the healthcare professional. Because, for example, in a short period of time, maybe it's already happening actually, decisions that take less than 2 minutes to take are going to be fully automatized when we speak of healthcare physicians. And this, what does this mean? This is going to enable the healthcare professionals to have more time to attend and to humanize their patients. And this is speaking about empathy and the beloved humanization of the patient. And when we speak about patients itself, when we speak about artificial intelligence, it's what's gonna enable us to be able to have at some point this equity, fully universal access, high standards of healthcare. How? The house has to do with including, and this is something that we should remind because we forget, the less favored populations in our algorithms. The less favored populations, because it's not only about creating our algorithms more ethical, but also including these subpopulations that sometimes have biases or present biases in the outcomes of our artificial intelligence algorithms. And we should also prepare the data set since the very beginning, before creating the algorithms. Prepare them so that we can get the outcomes that we are looking for. And this is, well, this is my opinion of what's yet to come and what's the next step towards our homes and our health techs, I would say, because I think all of us here are physicians, technicians, and we could say managers, no, around health tech field. So this is my humble opinion. So thank you.
Thank you, Sylvia, so much. As a startup founder, I think AI is definitely a buzzword. It's definitely something that's creeping in as kind of inevitable sooner or later to be integrated. And I think it's great you brought it in. I do sometimes, feel this kind of gap between innovation and, let's push forward and let's enter the new era of health tech, and then the traditional, patient goes to primary care doctor dynamic. So there's definitely a space to close up there and make everyone familiar with both sides and also reap the benefits of both sides. And what also came to my mind is making healthcare more efficient is through AI, through digitalization, it does also mean different things to different populations, I believe. And being more effective could mean that, yes, someone gets an answer in 2 minutes, and it's amazing that that it's possible to have that kind of assistance, and hopefully that it will be available to more and more people. But it could also mean that someone needs that human connection with the doctor, that face-to-face. Maybe it's something more, deeper, like a cancer patient. It's not a yes or no. It's not a few data that they'll read and they can get on with their lives. It's something much deeper. So I think that's probably a good direction to kind of involve the whole spectrum of people and their needs, and I guess on demand comes in very well in this sense too, that patients.
Just as a clarification, when I speak about this artificial intelligence enabling more time for the physicians to take care and humanize the patients. I'm not only speaking about the face-to-face in between the physician and the patient. For me, we are in an hybrid world. We are already remote telehealth is already happening, and for me it has the same value as a face-to-face. Of course, there are things that needs to be done in place in hospital, whatever, but we are moving towards this model of inpatient care. And inpatient care has to do with remote. So for me, this artificial intelligence applicability, it's not only for real life consultancies, but also for remote healthcare, for remote telehealth, whatever. So this also, just to clarify, thank you.
No, thank you. Thank you for the clarification. I think, there is definitely space for more and more, clarification. Let's get down to the nitty and gritty and just explore the possibilities and the new ways that we can operate and be better in our professional lives and give more to our patients at the same time. As a last round of questions, I know we also touched on this about how it can be integrated in the future, and if it's I think we agreed that it's definitely something we should embrace. If there would be a final, thought that you would like to share about on-demand healthcare, about the future, how you envision it at its full capacity, and I would just encourage all of us here to try to make this happen. If you could share these closing thoughts.
Back to the term of demand, actually I'm one of the people that I think there are a lot of things which patient they need. I believe that it's not only a medical treatment. So we are speaking now about medical treatment only, but in reality, no. The patient, they need more than that. We still need to focus on mental health, nutrition, a lot of aspects which I think demand will help us to apply it and to give our patient access to it. And back to the future, I'm thinking that we'll have more option, more digitalized health, but we don't mean that the quality should go down. So to just ensure that you understand it and you are all with us, we are with everything which can improve our situation, improve the access, improve the quality. But we are actually, for me at least, I'm against anything affecting the quality. But using this to facilitate our work and to success in our plan and our treatment and to give the patient what they need, not only what I want to give them, is very important.
Thank you.
Yeah, thank you so much. As a last thought, I would say that from my point of view, we should consider since the very beginning the respectful of the lifestyle of the patient. When we create the technology, integrating it considering the lifestyle of each and every single patient. And this has to do with, respecting the patients. And when I say this, I also would include the essential or fundamental from my point of view that will enable sustainability in healthcare happening, which is something that it's like, oh, okay, is it possible? And it has to do with patient empowerment. For me, patient empowerment is the key. We are every time more and more connected, and we are all patients, and we are more demanding, and of course we are more demanding. We require the highest standards of healthcare for us and for our families, and of course, so patient empowerment has to do with enabling the patients understand their own healthcare conditions, and in consequence, be able to take action towards it. So this relies on our heads, on our health tech companies. We are the ones that are gonna make this possible. The house, of course, for example, if I have a telehealth solution, for example, just to say something, I can include inside a patient support program. I can include in every call, after the call, some highlights for patients so that they can understand with genuine and trustworthy information, not something that I just invent, something that really worth it. And it's on our heads the training of the patients, this empowerment, so that they can understand their situations and take action. And they are the ones that are going to give us the solutions. Yeah? So these, as final thoughts, I would say these two concepts, from my point of view, they are essential. Yeah?
Thank you, Celia. Thank you, Amal. I think for me personally, it was a great panel, and I definitely take a lot with me. I think, you know, the highest standards we should apply to ourselves as sitting here today in Dubai as leading edge of, you know, of the industry. Most of you are doing great work already, so I just encourage you to carry on with it. And thank you so much. Thank you for the panelists.
Thank you,
A pleasure.
Hold on. Okay, amazing. Thanks, guys, for a great panel. Girls, excuse me. Take a seat. We're not done yet because I know there's I put extra time for questions. I don't want anyone coming up here and not feeling like they don't have the opportunity to answer questions. These guys are experts at what they do. They brought to you from around the world. I hear all these accents, Hungary, Spanish, right? I think you're from, you know, you can hear a whole bunch of accents from different areas. So we're taking our knowledge globally and bringing it together. I invite anyone who would like to ask these ladies additional questions about what the topics they've talked about, customer-centric being the focus here. Please take the mic right there, that one in the middle of the room. I'm not pointing to you, I'm pointing to the microphone. Would anyone like to ask the ladies some questions? Come on up, great. First person to the mic wins. I put a couple minutes here so you can engage, okay? Great, because I know what you guys have questions. Yes,
Hi,
sir.
thank you for the great talk. I'd like to share with you a little bit of experience of us. I'm from Israel. My name is Yves Biton. In 2009, we launched a service called Pediatrician Online. The first night of the launching, 3,000 calls. 3,000 calls the first night of the launching, 2009. Since then, millions of calls of Pediatrician Online. Why? And by the way, nobody pays. Why? Because we design it, and you talk about design services that are logic to the government, to the population, and you can design them that people will not pay anything. Why we design them? Because at the middle of the night, in the weekend, when there is a child with fever, do you go to an emergency room? It takes time, it costs money, so immediately putting a pediatrician online solves those problems, and it was very logical to our government and to our insurer. So this is one of the things we did. The other thing, you talk about artificial intelligence. What we're doing now, the service is a triage of a physician to people who wants to go to emergency room. Should I go to an emergency room? So we have a machine that do artificial intelligence, but eventually the one who decide is the physician. The machine is looking at the data and telling the physician whether it's a risky situation or you can manage it online. So this is the way that we interact with those things that you talked about. Thank you.
Great. Thank you for that. Though I didn't hear a question, but let's get some questions for the ladies. I'm sure it starts a conversation after you're off the panel, but one more question? Yes. Keep it to a question.
Yeah,
Okay.
I do have a question.
Perfect. Awesome. Thank
I'm
you.
the Chief AI Officer for Twill Health. So I have a question for Sylvia. You mentioned AI and the fears of AI, which I'm very familiar with. I would say there are justified ones. You mentioned biases. That's for real. There are fears that have to do with romanticizing AI and sci-fi and popular media. And there's also just the resistance to new technology. And I wonder if we have any magic solutions as to how to deal with those fears and help embed AI in more and more solutions, because there's a great benefit to it.
Fantastic, thank you.
Wow. So it's such a question. I don't think I'm capacitated for answering it. But I would say, from my point of view and my expertise, is that we shouldn't aim for panacea, something like it's just a matter of doing simple, small things. For example, what can we do? When we train our artificial intelligence models, we only think of healthcare data sets. Why? Why only healthcare data sets? We have lots of data sets that are available, fully open access. For example, we have the Copernicus in some satellites, these satellites that are collecting real-life data sets from quality of the air, quality of the water, radiation, all these data sets that are open access, as I say, in different countries. And why not incorporating them in our artificial intelligence models? It's not about creating the super artificial intelligence that will change the world. No, it's about simple, small things of daily lives that can improve our lives. And artificial intelligence is speeding them up at the speed of light, because it does what we can't do as human beings, of course. And we need to take the good part of it. The house, making the proper questions. We have the tools, and we need to, as humans, to make the proper questions that will make us move forward in the next step in terms of healthcare. I'm saying Earth observational data sets because it's the ones that pop up to my mind, but why not other data sets that are multidisciplinary, and that they can expand the value of our products. It's about, I have a product, but how can I expand the value of it? How can I expand the matrix of value of my product? And this has to do with incorporating other disciplines, thinking out of the box. What do we need? What's happening in the world? There are emerging communicable and non-communicable diseases, some of them that we hadn't even heard about them before, and they're appearing. So this needs to be included in our AI algorithms, because this is how we are going to be able to face them. Otherwise, we won't be able to. Right? That's simple, because we have the tools, let's use them properly, but let's use them.
Incredible. Give them a round of applause, these ladies. A lot of information. Thank you, ladies, for your time. Thank you for a great panelist. We opened up a can of a whole bunch of worms there, right? From AI to the future, right? Oh, don't worry. Don't worry. From the future of what technology and the impact of technology, private versus public, what are we going to do? How do we impact this? How do we move it forward? I mean, these are great conversations that we're bringing to you at Health 2.0 Winter Edition. So please, I invite you to definitely connect and continue these conversations, because this is where the change happens, right? I got shaken of the head. Yes, you're right. And these are why these events are so important. I love when people highlight what they've done around this industry so other people can hear new information that maybe they have not seen or heard of in their part of the world. That's why global events are so impactful. We miss them so much during COVID, right? It's not the same thing to do it online. It's nice to see people face to face. So, here locally in UAE, I know a number of us are new to this area. I always like to bring in facts of what's happening here in the region, especially around the topics that we're talking about. So in 2022, in October, there was a survey conducted to residents, around 23,000 people that live here, and it revealed that 77% of UAE residents of the country, they were very happy with the healthcare system. It was good or very good. So that is a great accomplishment, and understanding that information from the people living here to affect the way forward. And you saw this panel, customer-centric is the way to go, so that we can move in the right direction, that customers get what they need. And we're all those customers here in this room. So I thank you for keeping tune. Hope everyone is still enjoying today. We got a bunch of stuff to attend to this afternoon. So without additional further ado, I'd like to bring up something that was mentioned earlier, is a workforce around the healthcare industry.